So uh, this is a presentation on the pain response and the pain-related, health-related quality of life between in metastatic castration-resistant prostate cancer who were treated with second-line therapy. And the comparison was the trial originally published was a comparison between cabazitaxel and enzalutamide or abiraterone, the alternate therapy, whichever was used. And these patients were either post-docetaxel or post-first-line hormone therapy with the alternate agent. This publication focuses only on the pain response and the health-related quality of life. So to go ahead, next slide, please. Next slide, please. So the CARD study, which was published in NEJM in December 2019 by Witt et al., they reported superior PFS and OFS with cabazitaxel versus enzalutamide. In patients who had progressed on the first-line therapy. The first-line therapy could be docetaxel or one of the hormone agents, abiraterone or enzalutamide in the other arm. This trial looks at the health-related quality of life and pain scores. Next slide, please. Pain response was defined as a decrease of more than 30% from the baseline and with no increased analgesic use. Health-related quality of life was assessed using the functional assessment of cancer therapy, the FACT-P specific for the prostate questionnaire. Patients were evaluable if they had received at least one cycle of cabazitaxel or abiraterone and had a baseline FACT-P score which was measurable. Next slide, please. A clinically meaningful improvement or deterioration of the FACT-P score was defined as a difference of plus or minus 10 points from baseline. That is plus 10 points for improvement or minus 10 points for the deterioration. And clinically meaningful health-related quality of life and pain response were confirmed at 2 consecutive evaluations around 3 weeks apart on the on-treatment period. Next slide, please. Of the 255 patients randomized, 172 had moderate to severe pain at randomization. So these were the patients who were taken up for assessment. Pain response and health-related quality of life was accessible in around 111 of these 172 patients. That is around 86%, and 108 for the cabazitaxel and the abiraterone arms. Pain response was around 45.9% for the cabazitaxel arm and around 19.3% for the hormone therapy arm, which was statistically significant, which is also numerically a big, almost more than double. The probability of not having pain progression at 12 months was around 66% for the cabazitaxel arm, whereas it was only around 45% for the hormone therapy arm, which was also statistically significant with a good hazard of 0.55. Improvement of the total FACT-P score from baseline was reported in 25% of patients, whereas just 22% in the, so that was almost same, the numerical percentage of improvement. The FACT-P score was maintained or improved in 75% of patients in the cabazitaxel and in the atra arm, and deterioration of FACT-P from baseline was also reported in the nearly same number, 22 versus 24.6%. The median time to FACT-P deterioration was longer in the cabazitaxel. This was significant. Was longer in the chemotherapy arm versus the hormone therapy arm. Next slide. So this is the Kaplan-Meier for the survival endpoint, which was initially published in 2019 in NEJM. The PFS and the OS, primary endpoint was the PFS, was significantly improved in the cabazitaxel arm compared to a hormone arm with a hazard ratio of 0.54. And the OS also had a hazard ratio of 0.64 favoring the cabazitaxel arm with a significant p-value. Next slide, please. So the pain response, which was the what was looked at this presentation, there was a 45% pain response in the cabazitaxel arm versus only a 19.3% response in the hormone therapy, that is abiraterone or enzalutamide. And the probability of no pain progression was also better across in the cabazitaxel arm compared to the abiraterone or enzalutamide, the hormone therapy arms. Next slide, please. So cabazitaxel was associated with greater pain response and delayed pain progression versus the hormone therapy, that is abiraterone or enzalutamide, and was, however, they were associated with similar trends in the FACT-P questionnaire, and they were associated with similar trends in the health-related quality of life. But what was notable was the duration to deterioration in pain was around 14 months versus 8.6 months in the hormone therapy arm. That is, chemotherapy had a longer duration to deterioration of pain scores. Next slide, please. Thank you very much.